We have been told the only way we will ever be able to have sex is to inject a needle into the penis. Is this true? So I've had many consultations with men and their partners specifically about this question. They've often been told, you can do injections to create erections if you want to have intercourse again. And they've come to me to ask, are there any other options? Because the thought of the needle going into the penis is a bit confronting. I want you to know, no, this is not the only option. It is one option, and some people find it really effective to give them the erection they want to have, but it's not the only option. Today I want to leave you with 4 other ideas, and I'll put some links in the YouTube description box on how you can go in more depth to learn more about those ideas. First is the use of a vacuum constriction device, or a vacuum erection device, or very colloquially, a penis pump. The one that I professionally recommend after speaking to so many men about their experiences with different devices is the Vacurect. So this one is on offer through my website, and I also have an offer that includes a training series that teaches you how to use it for rehabilitation and intercourse together, so you sort of get the maximum results. And this particular one uses a constriction system with a 1-step process. So you'd place a smallish ring on the opening here, and there's 5 different sizes, so you find the size that suits you. You would place the penis flaccid in the opening, and that's how you remove the air from the cylinder, creating the vacuum. So each pump removes air, which draws the penis in. And then when you have the erection that you want, then you can see it in the cylinder. You simply remove the cylinder, and the erection stays up from the constriction of the ring. So there's one way, no needles. Now, a second way you can consider is another device, a vibrator. Again, everyone gets very different results, I find, when they start to use a vibrator specifically to induce erections. Some men find when they start to use a vibrator, they like the sensation, but it's not necessarily inducing a lot of blood flow or creating a lot of stiffness. Others find actually after some time, they have very different results. So maybe even 3 weeks down the line of using this regularly in masturbation, they see actually a lot more blood flow, and then a lot more stiffness comes later on. There's still a lot of pilot research going on the effect of vibrators and how this mechanism does work. However, from the pilot studies has been noted that the best way to use a vibrator for erections is to focus the vibration on the frenulum, which is the underside of the penis right here. Lots of nerve endings that we believe pass through the cavernous nerves into the base of the spine. So there you go, option number 2. And also worth pointing out, vibrators in general, it's a great way to just sexually connect, something new that offers a new sensation, and it's really just inducing a lot of blood flow, so it can also help if you're having numbness or a loss of sensation in the genitals. So next option you can consider are PDE5 inhibitors. So this is an option you would talk to your medical practitioner about for whether it's right for you, and keep in mind when it comes to PDE5, so that's Viagra or Cialis, it's often recommended to try after prostate cancer treatment. However, it very much depends on what's going on with your cavernous nerves. They surround the prostate, and especially after surgery, are usually in a state of sort of trauma for some time, and it's pretty difficult to know where they are on their recovery journey. In fact, one way of testing that out is to occasionally take a Viagra or a Cialis when you're feeling very aroused, low stress levels, and to see, do you have any erectile response, because that will tell you what your nerves essentially are up to. So again, another option, but please speak to your medical practitioner about whether that is right for you. And then we're on to, I've completely lost count now, I think option number 4, which would be the idea of a prosthesis. So 2 types of prosthesis you could consider. An internal prosthesis is a surgical procedure where they implant a prosthesis device that you can manually create erections by using usually a little pump system on the side. Again, there's a few options within that one. It's not my specialist area, so I'd recommend you speak to a urologist about who's the best person to talk to if that appeals to you. Another type of prosthesis is an external prosthesis. So this would be a dildo-like structure, and you can get them in lots of different sizes and different materials. I recommend highly a medical grade soft silicone as a good starting point. And you would attach that to a harness-like device. There are devices like this on the market for lots of different sort of sexual experiences. There are some designed just for men who have erectile dysfunction. Now, if that option appeals to you, email me directly, because I'm actually in a research stage of gathering some options together and trying them out with different willing customers, essentially, to find what's the best one for people who have erectile dysfunction after prostate cancer. So there you go, you've got 4 different options that you can work with. And I think my last message upon all of this is, through working with people over time, I have found that there is rarely, if ever, one way that works for them to induce an erection. Usually it's a method of trial and error with those different options I mentioned above at different times when it suits you, and often as well cobbling them together. So for example, I have clients who will inject a little bit but use the vacuum device before injecting in order to make the penis very supple and reduce pain, and also use it afterwards to actually move some more blood into the penis, and they may use a constriction ring on top of that to encourage more stiffness. You know, it's very individual, finding what works for you. It really is quite an adventure that you're on. If you are thinking now, goodness, that is actually quite a few options, where do I begin? Again, that's a very personal decision to make, and maybe suggest go with what feels right for you right now, what you feel comfortable approaching. And if you'd like any more information on the options, I'll pop some of those links again in the description, or feel free to please get in touch. I'd love to know, what did you find helpful in this video? What would you love to know more about? My email address is victoria@atouchysubject.com.